Good morning, everybody. Thank you for coming out today. We're going to get kicked off with this. What I'm going to do is I'm going to introduce first Commissioner Val Arkush. We're very grateful that she was able to come out today. She does have a commissioners meeting, so she has to run after this. She's not able to stay for the whole meeting. But to start with our opening remarks, I'd like to introduce Commissioner Arkush.
Thank you, Jim. Well, good morning, everybody. It is such a pleasure to be here with all of you today, and I am so excited that this event is here and happening. We work very hard at the county level to make sure that we are connecting with all of the different constituencies and groups in our county, and there are many. And I think the first time that we really realized that we did not have as strong of connections to the faith community as we could was in some of our early work on the opioid epidemic. And we actually ended up convening an event in, I think it was 2016. It might have been early 2017 at this point. And we had a number of members of the faith community and faith leaders attend. And we were so happy at the end of that, sort of half day, because we had better connections and many leaders left with tools in their toolboxes that they did not have before in terms of how to help members of their congregations get help if they needed it. So I think it was a great start. And in some ways, that was the roots for where we are today, because we don't want this to be a one-off. We want this to be the beginning of an ongoing and very robust conversation, constant ways of looking for opportunities to work together, and really, I hope, very much a deep partnership. I want to acknowledge Tara Gaudan, the director of our Health and Human Services Department. Hopefully you get a chance to meet her today. And I also want to thank Elizabeth DiArcangelo, who I know she's sitting back there. She's always very, hiding in the back, but she did a ton of work to make this event come off today. And I hope that this is really a conversation, really a dialogue. This is not about us talking to you or vice versa. I hope that people can get to know one another. I hope that when you leave here today that you will have many, many more tools in your toolboxes with which you can use in your daily work to help the people that you care for. I am a physician by training. I practiced medicine for 20 years, and now instead of one patient at a time, I have 828,000 patients at a time, and I'm sure you all feel that way on some days too. What's so critically important is that you are often the people that our constituents go to first. You might be the person that they trust the most. And on the flip side of that, when you make a recommendation or a suggestion, you're the trusted messenger. I can tell someone or make a recommendation to someone to do something till I'm blue in the face, but if they don't trust me, it's not going to matter. But they will trust you. And so it's so important that you have ideas and thoughts and places and connections and know where to go. This is going to be critically important, not only in a lot of our health and human services work, which is ongoing and spans all eternity, but next year in particular is the 2020 census. And it will be critically important to our constituents that we count every single person. The dollars that are at stake are in, just for our county, over $100 million over the next decade if we don't count everybody. And unfortunately, our state does not have a great track record in this effort. In the 2010 census, Pennsylvania ranked second in the country for the number of dollars of federal funds that were forfeited because we undercounted so many people in our Commonwealth. So I am committed to making sure that that doesn't happen again, at least for Montgomery County. It's the only thing I have control over, but we're going to do great. And the faith community is obviously a huge part of that. So if anyone is interested in getting more involved in that efforts, I think some of you already are, but Elizabeth is also one of our liaisons to Montgomery County's Complete Count Committee, and we do have a faith based subcommittee, and we are looking for volunteers. Our Complete Count Committee already has, 130 members, I think. I would love our Complete Count Committee to have 500 members. There is no ceiling on this because this is a grassroots up effort and it's going to take everybody. So again, thank you so much for being here today. I hope this is just the very, very beginning of a really deep and ongoing conversation. I know your time is precious and I appreciate that you're spending some of it with us today. Thank you.
Thank you very much, Commissioner. We're going to move along now to introduce Reverend Ted Mingle, and I just wanted to say thank you very much for hosting this event today and giving us the opportunity to do this. And Reverend Mingle's going to lead us off with the welcome and reflections.
Thank you, Jim. Appreciate this time that we have together, and good morning. And welcome to the Interfaith Coalition Conference. And it is our honor to be able to host this conference as well. Just two details in terms of logistics. Do want to make you know, in case you don't know, that right through these doors here to the left are restrooms if you need them this morning. And maybe most importantly, in case you missed it, the coffee is right there as well to your right. I know how much I need my coffee, and certainly we have wonderful refreshments in the back. I do want to thank Jim and Mary Rodenbush, who are in the kitchen. Let's appreciate them for doing all of our beverages and food today as well. And I do want to appreciate two of our parishioners, Judy Baker and Annette LaFors, for helping to make this conference happen today as well. Thank you so much. What a wonderful event as we come together today as people of different faith traditions to collaborate on how we can support the people of Montgomery County who are in need. I want to thank everyone for being here and taking time out of your busy schedules to make a difference in our community. And thank you again so much for being here. And now I'm going to open up our time with a word of prayer. Let us pray. Loving God, we thank you for this opportunity to gather today to collaborate on how we can be a support to those who are struggling in our community. God of all people, we pray that you might speak to us through one another as we share our resources of how we can care for those who are in need. Gracious God, you have blessed us in so many ways, and we pray that you will guide us in our conversations so that we can bless others through the resources that you have given to us. This we ask in your name. Amen. Thank you.
Thank you, Reverend Mingle. What we're going to do now is I want to take the time to also acknowledge the Montgomery Foundation and Virginia Franz. If you could please stand up. As far as the coffee, the food, the event, Montgomery Foundation is sponsoring the event, and the Anti-Hunger Network as well too, that serves Norristown and Montgomery County. So thank you very much. And we've got the housekeeping taken care of. Thank you very much for that, too. So we do have the food, coffee, restrooms, and exit signs as well, too. Please take note of those in the room in case there is an emergency. We're going to move now to the panel discussion. But prior to doing that, I just want to talk a little bit about the flow of today's meeting. The panel discussion is the first part of that, the first part of the meeting today. And we really wanted to design that to really share some information with you about some resources that are in the community, some faith leaders that are using those resources and helping people in the community, and then some information about the effectiveness of the collaborations between the service providers and the faith leaders. So we really want to kind of hit home on that information. When we're done with that, we'll take a little bit of a break and then come back together because we also really want to hear from you. The second part of this meeting today is going to be a breakout session where you're going to break into small groups and you're going to get to talk in those small groups, and we can gather some good information from you, and then we'll report that information out. So right now I'd like to introduce the panel. I'm going to ask if Reverend John Buckley can come on up. He's going to be the moderator for the panel. And then I'd also like to invite up Elizabeth DiArcangelo from Community Connections, Dave Eckert from Intersect and Access Services, Gabrielle Kaplan-Mayer from the Whole Community Inclusion Jewish Learning Venture, Sandy Lawrence, who's already up here, thank you very much, from the Philadelphia Coordinator of Clergy Coalition, Reverend Doug Moister, a pastor of Renew Community. And then Moira Tumulty from Crisis Services. I don't know if, oh, yeah, there you go. Okay, very good, very good. And excellent. And now I'd like to pass it on over to Reverend Buckley.
Thank you. Well, good morning. As has already been said, I'm glad you covered the names because I was reading over. I thought I might have to introduce everybody. I don't know everybody, and I saw the last names and thought we're going to be in big trouble. So thank you for covering all the names. We're just going to start with a little bit of an introduction from each of the panel members, and myself as the moderator. As was mentioned, I'm Pastor John Buckley. I pastor a church in Upper Perk Community Church is the name of it, up in East Greenville, about 40 minutes away from here. My story is one of a very personal interest, or the reason that I'm interested in the whole concept of communication and bridging between resources in the faith communities. As a pastor, I've dealt with it for years. And growing up as a pastor in the younger years of my ministry, really being taught that most all issues were spiritual issues. And I believe there's a spiritual foundation to all issues, but there's a lot of them that need resources outside of that to deal with people in a holistic way. And then God chose to give us a son who struggles deeply with mental health challenges. And so I had personal reflections on that as well that brought me to a different point of crisis in our lives that led us to realize that really there was a breakdown in churches understanding what resources are even available for those that struggle. So it's been a crusade of mine to try to help churches understand the resources that are available, find as many as possible, and then try to combine a way that we can bridge the two communities and realize that we're all striving for the same goals, which is holistic health for individuals, especially that struggle with mental health. So I've had the privilege of being able to do that. We do mental health Sundays now and different things like that. But it's a privilege to be able to moderate this, and I'm looking forward to some good discussion and questions from all of you. So thank you again for attending. So I'm just going to let you guys go right down the line and give yourself your intro. We'll start with you, Sandy.
Good morning. Is it on? Yes. Okay. Can you hear me now? I'm going to take it out. That's much easier. Thank you. All right. Always giving honor to God because I'm in one of his houses and temples, so I have to do that this morning. As you know, my name is Sandy Lawrence, and I am from Philadelphia. I previously was employed by Philadelphia Corporation for Aging as the Interfaith Outreach Coordinator in the Human Relations Department of Philadelphia Corporation for Aging, better known as PCA. And that's how I wound up here. That's where I came from. And the basis of my position was I am a lay leader in my church, Vine Memorial Baptist Church. I am a deaconess there. And as a lay leader, I was very comfortable with the diversity of faiths. Previous to my employment, there was someone that was there in that position before me, and pretty much it was very Christian focused as opposed to all faiths focused. And when I came in, I said I'm a respecter of the differences and an appreciation of the similarities because there's always, it's God, and it's the other variables that we differ in, but that is our connection. So I was very comfortable with that. So as a result of that, we realized that the faith community is where the people go. And the people are who you serve as workers in the system. And in order to reach the people, you need to be or be connected to where the people are. And basically a large proportion of your people are in the houses of worship. Because regardless of what we go through, many people have faith. And they have faith in the evidence of the things not seen. They have hope. So with that, it is a trusting relationship. You trust your faith. You trust your faith family. You don't necessarily trust the system. And if you are in need, you need to have clarity and understanding of what is available for you. So there's a certain level of hopelessness, especially in Philadelphia, that we encountered with people that didn't even know about the resources that existed. There are so many people that just don't know. and they have no way of knowing, but if they come to their house of faith, they're going to trust the answers, they're going to get answers, because we embrace the relationship between the community and the county, which was PCA. We were the Department of Aging representative for Philadelphia County, for all of Philadelphia County. So that's how we had to bridge that gap. And that meant we had to go out into the community and go to their house, which is their house of faith, to connect with them, to meet with them, to hear what their needs were, and to make sure that they knew that we had the resources to supply the needs as much as possible. But it also helped PCA in terms of we were able to go out and find out what are the needs of the community, and let's see how we can either change, alter. If we don't provide it, we'll figure out a mechanism to provide it, and as best we can. So that is how I wound up here today. I was with PCA for approximately 11 years, and I just retired last September. So that's where we're at today. So I'm going to pass it on now.
Good morning. My name is Dave Eckert. I have been throughout my career in the adult mental health field, working at Access Services, directing mobile psychiatric rehabilitation services. During that same period of time, I've also been one of the pastors at a church out near Montgomeryville, Chalfont area. So I've been living in both of those worlds for my entire career, and I've learned a couple things through that experience. One is that faith communities oftentimes struggle to know, how do we walk with people and support people with mental health struggles, and what are the best services out there that could help them? I've also learned that it's hard for a lot of human service providers to know, how do I best pay attention to the spiritual dimension of someone that I'm walking with and trying to support? So as a result of living in those two worlds and seeing those challenges, we started an initiative called Intersect, which the mission of it is to support people at the intersection of faith and mental illness through training and consultation and through fostering collaboration between human service providers and faith communities. And we've seen a lot of great things happen through that, but we've also continued to learn some of the challenges, which we'll talk about today, because the great part of that is I think a lot of those challenges that we'll discuss are actually opportunities for some really amazing things to happen just as a community-based system of care. So that's what we'll be talking about today, and that's the angle that I'm coming from. Thanks.
Good morning, everyone. I am Maura Tumulty. I'm the director of Montgomery County Mobile Crisis. A little bit about me and my background, as I had to type up an introduction and give it to Dave. Not that I remember everything I wrote, but I really thought about myself and how, in my own personal life and my professional development, I have naturally sought out opportunities where there's the intersection of faith and mental health. So to give you some background, I got my undergrad and graduate degree at the University of Scranton, which is a Jesuit institution. And during my master's time, I was a graduate assistant in campus ministry. When I finished up there, I actually moved to Chicago for a year to do a year of volunteer work, and lived in a volunteer community where one of our pillars was spirituality and social justice. So then coming to Access, I've been working in mobile crisis for 6 years now, and I think one of the biggest things, and I've already heard some of the panelists talk about it, is people need people, and people need community. And oftentimes when we see individuals who are struggling, there's a sense of hopelessness that we talked about, or disconnect. And as mobile crisis, we want to be a resource for you all. So whether that is just to call us 24 hours a day and you need some consultation and talk through some stuff, what's out there, how do I navigate this, or how can we help? I can say there's been a couple of times when faith communities have gone through tragic or traumatic events. We've had the privilege of being invited to walk with them and support them through that, which is always, it feels very sacred to me, and a privilege to be invited into that community and to be a resource. With that. I'm very lucky to have Dave as a resource at Access Services as well. And so I always say, I know I think there can be stigma with the word crisis even, or I'm not in crisis, I don't, and I always wish I could change the name to like Mobile Hard Day Service. Like always, because I think we don't have a clear definition of what crisis is. Whatever anyone is having, whatever that is, that looks different for everyone. And so a privilege that I've really enjoyed is that mobile crisis, we're not cookie cutter. Sometimes some people just need therapeutic counseling on the phone, and maybe they're not connected to a long-term counselor, or it's 3 a.m. and they need somebody to talk to. But our end goal is always to help somebody create community so they have a friend to call, whether that's in their faith community or a family member, and strengthen those relationships. We believe that people are holistic, and that means more than just like the physical health and mental health. It's also spiritual health as well. So that's a brief bit about me and what we're about at Mobile Crisis.
That's your new tagline? You're going with that one? Okay, awesome. Good morning, everyone. Elizabeth DiArcangelo, thank you very much. I just want to, first of all, say thank you so much for coming today. We are super appreciative. We really are very excited about this event. But a little bit about myself. So I am the administrator for the Office of Community Connections, which is one of the program offices under the Department of Health and Human Services, our director, Tara Gaudan. I've been with the county now for 3 years in this role, and I come from Philadelphia, like Sandy. My roots started in Philadelphia, working in the children's case management system, and where you learn a lot, especially in the Philadelphia system. Wow. But one of the things, and so most of the children we worked with were coming to us with mental health challenges, but we were actually taught to look at things in a holistic way. When you provide case management, there's this whole sphere of avenues that you're supposed to look at. But I can tell you, looking back on that now, one of the things that wasn't often asked or really questioned with people was their faith and their spirituality. And it's kind of like, what, you want to say you're holistic, but are you really if you're not really addressing that piece? So looking back on that now, I recognize that and think that that system could probably do a little bit better with that, and that's part of the reason we're here today as well. But yeah, I've enjoyed being here with my Navigants. We have Navigants in all 4 areas of the county, so if you're not familiar with the Navigants, they are our staff who are navigators and advocates for people in need of services. Just a quick show of hands, how many people before today knew about Community Connections Navigants? You guys don't count up here. Awesome. Okay, so for those of you who are not familiar with you, I need to get you later. We also have 3 Navigants and a supervisor here, so I don't want you to leave without learning more about us. But their role is really to help and be partners with those of you in the room for the people you're serving, to help you find resources that best fits their needs. So they may be coming to you saying they need help with one thing, but we know that there's a lot of other things that they may need help with, and the Navigants can be the answers for those. So thank you again for coming.
My name is Doug Moister, and I am the lead pastor at a community in Lansdale, Pennsylvania called the Renew Community. We're a church. We've been around for about 11 years. And I come to this from the perspective of some of our mantras at our church are no perfect people are allowed. And that starts with the pastor. And so we really get the sense that whether you are like living with mental illness or mental health struggles, you need family. Like mental health struggles isolate people. And so we really feel like the place where we can intersect this, this human condition that all of us have either gone through or have friends who've been or who are in, is we desire to create family. And so part of that is calling Dave Eckert at 3 o'clock in the morning and being like, Dave, I got this really hard thing. What do I do with this? And he's able to jump in. And we just really have noticed Renew is becoming a safe place where people who have mental health struggles feel safe to come and like actually share their story and not be afraid of the stigmatism that happens there. And so one of the things that we've also noticed is some of the stories that we hear, some of the stories I hear as a pastor who sits and has coffee with different people is, I was part of a church until I started having like severe depression. And then the church didn't know what to do with me. And so for us, we just feel like, man, we have to be able to be resourced and equipped. And, most of us, we've learned how to read the Bible, but we haven't necessarily learned how to just love and care for people super well, and how to understand depression and what does that mean and what can we do and what can't we do to understand our limitations, but also to realize just the presence of being a person and loving someone else through a hard time Like, that's what I think churches can do really well. We can't diagnose, we should never diagnose, but we can walk with people well. And I think we've really been learning what that is. And a lot of that's been from like conversations with Access and just really just paying attention to what's happening within our community, even conversations with our mayor. Hey, you know, what's going on in the community that we should know about? Where are people who are struggling that might need someone to come alongside and to help out with? And we're a really small community. We're not big. We're about a little bit over 100 and some people. But we really feel called to like love all the folks within our community. And so, yeah.
Good morning. I'm Gabrielle Kaplan-Mayer. It's really an honor and a pleasure to be here this morning. I connected with Dave about a year ago or so, and it's really been wonderful to, through some opportunities Dave has created, to share about the work that we're doing in the Jewish community. I direct an initiative called Whole Community Inclusion at an agency called Jewish Learning Venture. And our focus is on awareness and support for people with disabilities, period. So that includes cognitive, developmental, learning disabilities, physical disabilities, as well as mental health. And of course, we know that for many people, it may be living with multiple disabilities. Reverend Buckley, I really appreciated that you shared about your son. I have a dear son who is almost 17, who has, right now we're at 3 major diagnoses of autism spectrum disorder and intellectual disability and bipolar disorder. So, humbling as a mom and eye-opening in terms of a spiritual journey, and really the inspiration for me in my relationship with my son is to always connect with him on a soul level, and we have a pretty amazing relationship. And I want that for all of the families in our community who may have a child, a parent, a sibling, a spouse, a loved one with any kind of disability, that person is recognized as we say from our Jewish tradition. I'm going to quote from the beginning of what we call Bereshit, or the book of Genesis, B'Tselem Elohim, created in the divine image. And that disability is not a barrier to that. I really wrote down no perfect people allowed, because this idea that in all of us are challenges as well as, many gifts.
Thank you. And I understand that you're not going to remember everybody's names. So if you want to say, when we have open topics to talk about, you can say the second panelist in or third. Try not to make any comments about the way they look, just comments about where they're at. And I'm going to apologize now. I love fall, but my fall allergies have kicked in, so I'm not contagious or anything. I'm just irritated by my allergies. So if I drink water or pop a lozenge in, it's because my allergies decided to kick in this morning. The pluses and minuses of fall. What we're going to start with is we're going to have 3 questions that we've already determined ahead of time to kind of get you thinking and to get the discussion started. So I want to let the panelists, each of them will be kind of kicking off one of the questions. And I encourage you, if you can write some notes down, because as soon as they're done, I'm going to open it up to everyone here for you to be able to ask any of the panelists. Now you know a little bit of their background. You might be able to direct a question that might specifically tie into one of the panelists up here. So again, we're going to say this is for anyone, and we'll lead it that way. They all have microphones as well. Do remember, they have microphones, you don't. Those of you that might be my age or older, I'm not going to do a Phil Donahue and come out and reach the microphone over everybody. So just kind of speak up, and I believe we can hear those. If not, we can ask for clarification on that. So the first question that we've laid out for the panelists, and I believe Doug is going to be the one to answer this one to start at least, and then other panelists jump in, is while providing community outreach ministry, can you describe a success story that highlights the importance of collaboration between faith communities and social service providers?
Yeah, Absolutely. I think two things. First thing is this. I'm really fortunate to have a relationship with Dave and Access Services, because there are times when I'll get a phone call or an email from Dave. Hey, Dave, Doug, I'd love to sit down and have coffee with you and this person, say Larry, who's looking to enter into a faith community. Would you be open to that? And it's fantastic. We sit down. Normally, we are able to have these really in-depth conversations about what they're looking for in church, maybe even honoring some of the pain that they've experienced from faith communities and being able to kind of work through that and just to invite them into that process. And so it's been really great to have just seeing the way that folks, that Dave has been an advocate for us and we've been able to be an advocate for him. Another thing that we do as a community is we have a thing called community dinner that we do once a month. And we sort of looked around, and the mental health community has a lot of really great opportunities in Lansdale. But there's sort of these like intersects of folks in Lansdale that have mental health struggles, and that's like there's usually lower economics involved. There's normally, and we have the sort of a place that really is an advocate for people in that mental health / low economics / whatever catch-all kind of like people on the hard day service folks. And it's called Manna on Main Street. And they have a meal. They have meals every day, usually breakfast, lunch, and dinner. It's open. People come and they eat. But one thing that we sort of noticed over the years of being there, and so a lot of this is just after years of observation, is even though there's this really robust community that's happening, so much of it is they feel like they're just someone to serve. And so we thought, what if we created a meal where we sit down and the purpose is to create community. And so we've been doing this for almost 2 years now, and it's been this really beautiful intersect of folks who are coming, and some of them have had some really difficult struggles with bipolar or schizophrenia or even just disabilities, across the entire spectrum. And what's been really exciting to watch is how they'll come, but we start to see people interacting from our church and from the community. And it's like creating this really cool thing. And this isn't a bait and switch like, hey, since you've come back tomorrow so you can come and, be part of our church. And, the tithe envelopes are on the side. We just say, we're just looking to be the presence of Christ present in this community. And so it's been this really beautiful intersect. And what we've been able to watch is we've just seen people come back and bring friends, and they bring friends. And we've just had this great opportunity to watch people find community. I think there's a lady named Rose who struggles with bipolar disorder. And a few months ago, or about a year ago, she mentioned how her house was a mess and her daughter was coming. And she was really nervous because her and her daughter have a very difficult relationship because of her mental illness. And so she mentioned this to one of the folks who's there kind of helping out, and our church got together and we had a cleanup day for Rose. And we showed up and we basically helped her throw away more stuff than I've ever seen in my life or donate. And it was this really cool opportunity for us to just to love Rose and for Rose to begin to trust us. And to trust the people that were there. And it's really been neat. She's been coming to a Bible study, or we call them house churches. We kind of do a weird structure where we have church in the Boys and Girls Club. We don't own a building, and then we have church every other week in homes all around like Montgomery County. And so what's been really neat is she's gotten connected, and all of a sudden she has family. So when stuff comes up now, she's like, oh, I just was talking to my house church, and they're doing they're insulating her house in a few weeks. And I'm like, how in the world does this happen? I think of, but there's just countless stories like that of folks that because we've built these bridges of trust, they begin to hold the weight of truth, and we're able to begin to just love people well. And it doesn't feel like you show up to a service opportunity, but you show up to build relationships. And it's been really cool to see how that community has formed. And it's a mess. I mean, it is messy. And that's the thing, I think, as I talk to other pastors who are asking questions about this, it's hard. It's really difficult work, but we believe in this gospel, this good news. And so even though it's hard work, it's the most important work that we do. Yeah.
Thank you, Doug. Any of the other panel members want to answer that question as well, again, highlighting the importance of collaboration between a faith community and social services. Sandy's got the mic.
Okay, I'll try to wing that one. I think one of the biggest moments that I was particularly proud of is for the senior nutritional, the $20 fresh fruit and vegetable vouchers. Are you familiar with those that are given out every year? So they were not distributed in large numbers, and there was always a huge leftover of vouchers because you had to come to agencies to get them. A lot of people didn't even know about them. So again, the relationship of having someone that goes into the houses of worship and or having of what was my job was the Clergy Aging Interfaith Coalition Group, which was a relationship between PCA as well as other resources and the faith community. So we would meet quarterly and we would hold conferences twice a year. So with that group, what we did was we said, well, what is the problem? And they said, well, nobody can get there, nobody knows about it. So we brought the vouchers into the houses of worship. So what we did was we had people that would come out on the weekends or weekdays when they were meeting during daytime hours, whenever they were prayer meetings, whenever they were Saturdays, houses, whatever their Sabbath day was. We brought people in that actually gave them out and allowed them to sign up after their services. We doubled the numbers of vouchers we were able to distribute on a yearly basis. And while we did that, we also provided additional resources that they may not have known about. So when they got the vouchers, they also got a bag of resources. We also had other local, the utility companies, the others come out, and they had tables to offer them programs about how to keep your utilities on, what to do, things of that nature. That I was most proud of, and that's still going on. So now we have a waiting list of every year, the houses of worship are ready. Come to our house, give out these vouchers. You would be surprised how many people would come in from the community. It's almost like an evangelism opportunity because people would come from the community that weren't necessarily coming to the houses of worship, and they were coming in to get the vouchers because it was coming to them. It was such a glorious experience. I think the other piece, not just necessarily dealing with seniors, is we also have a program called Dom Care. And that was for 18 and older, those that had challenges that could not necessarily live alone. So we were able to advertise that program. We were able to do that as well. And I think we covered kinship, adoptions, and grandparents raising grandchildren. So we had a lot of programs that people didn't know about that we were able to bring, just using the vouchers as an excuse to get in the door. And after that, I think our proudest moment, well, there was a lot of pride in this, a lot of pride. But another proud moment, I think, is the fact that our coalition group began to grow. And people said, there's value in coming out and listening to what you have. So what we did was we introduced not just our resources, but the subcontracting resources, the citywide resources, private and public, and they came together and we would actually ask them, what are your needs? And then we'd figure out, okay, this person has that for you, this one can do that for you. So I think the proud moment is it all kind of came together with the vouchers, and we're talking about in Philadelphia, you're talking about thousands and thousands of vouchers that are actually distributed every year. So I think that was one of the proud moments that showed the benefit. Thank you.
Thank you. We'll go to the next question so we can keep moving along, but feel free later on to swing back around. As a social service and county agency, how does a strong collaborative relationship with the faith community help you to serve your clients and consumers? And I have down all three, Elizabeth, Maura, and Gabrielle. If any of you want to jump in and start it.
Hi, good morning. So I think I mentioned earlier, the Navigants are in 4 of our county offices, all dispersed pretty much throughout the county. So our headquarters are in Norristown. We have offices in Lansdale, Willow Grove, and Pottstown. And that was specifically set up that way so people in those regions wouldn't have to come to one localized area, say Norristown, to receive services. And the goal in setting up the Navigants was really to help people in the communities understand how to access the resources they needed. I know prior to coming to my role here, I worked in Montgomery County for over 8.5 years, and I can shamefully say that I did not know about the other program offices that the Department of Health and Human Services provides. So how are the people in the communities really supposed to know? Here I am, a person working in the system, and I didn't even know that. So when I learned about the Navigants and this role here, I thought, well, that totally makes sense that they would have had such a brilliant idea and designed this program. So I was thrilled to come on board. I really thought that I knew all the resources available until I started to work with the Navigants in each of their areas. And I have to say, each area and how they interact with their partners, some of you in this room, is very different. The resources are different, how they help, the way they interact is all very different. And that's fine, and that's, each community, does what they need to do. But I learned that all the types of relationships are important. So in one of our regions, the partnerships with the faith community looks a little bit more like a coalition coming together, sharing resources, what's new, what's happening, are there ways they can brainstorm and work together a little bit better. In another region, we have Navigants who are able to reach out to the faith community and say, hey, I have this person who's having a super bad day, maybe doesn't need crisis, maybe they do. We've exhausted all the resources that are available, but this still remains. This is still an unmet need. Can you help? And oftentimes in that one particular region, there are some faith partners who will step in and help. We have another region who has a more structured relationship with the faith community where they will, if someone comes to their door, to one of our faith community partners, comes to the door asking for assistance, they'll actually wonder, have you spoken to the Community Connections Navigant in the area yet? We encourage you to do so, please do so, and then they will follow up with the Navigant in that region. And then the Navigant will engage and kind of talk and discuss what's happening, what have you tried, and go through a whole list of resources that may be available to help, resolve some of their needs. And if they have still unmet needs or there's really resources out there that, there's still something missing and that they know that the faith community is willing to help out, then at that point the Navigant can make a referral to their partners in the faith community. And some of them will step in and say, I can help this much and I can help in this way. And others say, oh, I can't do that this time. But there is a more formal relationship in that region. So we see the relationships functioning very differently, and they are all very important. And we are so blessed to have those relationships because, as I said earlier, when I did case management, there's mental health services, there's crisis service, thankfully for those, there's housing supports, there's services for children's mental health. So there's a lot of other resources, but those connections with those of you in this room are so very important. And we've just seen how that really helps people, access services better and receive the help that they need in the most appropriate way.
So a couple themes that, when I think about answering this question, I'm already hearing. I think there's a lot about connection and community and allowing people to come as they are. And two, just being able to be adaptable about resource. As mobile crisis, there's a lot of things we're kind of specialists in, which is crisis, but we try to be generalists in a lot of things too, of knowing all the resources. There's no way to know all the resources in the county, and I think there's so many that faith communities know about that we don't know about, that are options and support. And I think that's, as Elizabeth was saying, just the out-of-the-box stuff. I've seen so many ways that faith communities have helped individuals as well overcome barriers to access to resource, whether that is a ride to church every Sunday or a ride to service or a ride to my therapist in my intake appointment because I'm isolated and I don't have access to public transportation where I live. And so I think there's just such a value that we couldn't do it without it. I mean, the individuals that we've seen who are connected with faith communities, just amazing the way they show up, cleaning a house, to create trust and more connection. I think that too, there's a way of showing we're all human when you are sitting with somebody as a faith community and saying, I really care about you. I want to help you. I know I might not be the best person to do this, but let's call this other resource together so we can figure it out together, that there's no expert in a relationship, that we're all just kind of have our passions and are good at what we're good at. And I'm so grateful because I think I value therapy. I value, professional services, but people having connection to faith communities, to community, and then also having an opportunity to give back and have opportunities to volunteer and feel like they have meaning in their lives, regardless of any diagnosis, regardless of grief, regardless of being in recovery with substance use or a mental health diagnosis, helps people create meaningful lives that they want to live. And so I think that's also a great piece of being a part of faith communities, individuals having opportunities to give back as well, regardless of where they're at in their recovery.
So I think collaboration is the key word in this question for the work that we're engaged in. So at my agency, our role is primarily to help people find connection and access within the Jewish community. So finding a synagogue, a school, a camp for their child, and sometimes disability becomes a barrier to doing that. So I'm helping people to find, here's a synagogue where I know they're really far along around inclusion issues, and this would be a great place for you to connect. But we know that many of those conversations lead into much more significant needs for families, particularly in the transition age, as people are looking at, are there going to be work opportunities for young people who are leaving the school system, housing, meaningful employment, et cetera. So we actually put together about 10 years ago a consortium of different agencies working across the Jewish community, doing different types of social service work. So it includes Jewish Family and Children's Services, which has lots of mental health caseworkers, people with developmental disabilities caseworkers, programs for adults with disabilities, JHI, which is an agency focused on housing, JAFCO, which is another agency that's focused on adoption and children in the foster care system, et cetera. And there are about 10 agencies that come together every month. We facilitate that so that all of us know around the table what's available both within our Jewish community and in the larger community, that so that when any of us get a call from someone that we feel like we know where to send people for support. And me being here and learning about more opportunities across the community and sharing it back with the people in that consortium has been incredibly valuable. We do work in a 5-county area: Philadelphia, Montgomery, Bucks, Delaware, and Chester County. So the geographic territory of the people we're serving is really diverse, and that can be hard because I might get a call from someone who is more isolated in an area of Bucks County where they wouldn't be able to access some of what's happening here in Montgomery County. So we do our best to be aware of as many opportunities as possible.
Thank you. I'm being reminded as my pocket is vibrating that my phone is on silent, but I just warn it because I know as a pastor, the one person whose phone starts ringing in the middle of the service is always an embarrassing situation, especially if it's the pastor. So just kind of a reminder, if you don't have your phone on silent, I encourage you to do that or vibrate. We have one last question, and then we're going to open it up to everybody else. And Sandy kind of answered this to some degree, but I know there's probably more for it. And this is for Dave and Sandy in particular. In bringing together faith communities with social and county service agencies, what are some of the challenges and the successes that you've encountered, and what have you learned in the process?
So I'm just going to briefly mention what I think are two significant challenges. One is a systems challenge. The other is a challenge of stigma. An example of the systems challenge: I was once moderating a discussion between a few clergy and a room of human service professionals. And there were a couple of statements made that have stuck with me. The clergy member said, "I didn't even know any of you guys existed." And then someone from a drug and alcohol clinic came up to me afterwards and he said, "I've never been part of a conversation like this before." So you have these siloed communities of helpers who both want to be about some of the same things, but they just don't know each other exist and aren't in dialogue. And then even when that dialogue does happen, I remember one pastor saying to me, I'm reaching into my bag of resources, my brochures, and I just don't know which is the best fit. I need help with this. And some of this is just helping them know more about the things happening with community connections. But there are just systems issues, just one more example of that. I remember a congregant from my own church once saying to me, "Dave, I really want to serve my community, but everyone on my street looks like they're doing okay." Yet I knew someone 3 doors down from him that was being served by Access. And I thought, if only there was a way of connecting that congregant and that person, but there were just no systems, opportunities and processes to really make that happen at that time. I know we're trying to work on that. The other issue, besides the systems issues, is the challenge of stigma. An example of, and I think it's stigma on both sides. I remember once I did another one of those moderation of panels, and a pastor said something which I thought was really wise. He said, first of all, I need to confess my church in particular, and many faith communities, there's a lot of stigma there for people in particular who have mental illness and other experiences. And I need to own up to that and confess that. But probably, he said, when I walked into this room as a pastor, there were probably some things you thought about me before getting to know me as well. And therefore, I've seen stigma on both sides where we just assume the other side thinks something or will react in a certain way. Some of that's fair. Some of that's been earned. I have a lot of pastors who say to me, I don't make referrals to any agencies because I don't know who I can trust, because I don't know if they're going to respect the faith of the person who I'm referring. Yet I also know a number of organizations who want to holistically serve people and will respect them. So there's a lot of stigma, some deserved, but some that's just not really helpful to making this work happen. And when I have seen those things be addressed in both organizations and in faith communities, I've seen amazing referrals happen that have helped people, to Doug's point, find community. Because as good as a service is, and I'm a service provider, we can't provide people with community. And that's one of the great reasons to make these connections.
Okay. I think that part of the challenge was building a relationship of trust and recognizing that people just don't know about the resources. So how do you bring the community and how do you bring the resources together? And we did that by having the coalition group. And what that was, we had representatives from the community that came out on a regular basis, and it became very user-friendly. The system had to become user-friendly so that the community would embrace that system. Then they would be more willing to learn what there was available for them. Another challenge, I think, was also keeping it interfaith, or making it interfaith, I should say. We were largely, and it was a very small group when I first started. You could count them on your hands and one foot. That's about how many members there were in the coalition. And it grew during my years there to almost 400 on the mailing list of people, but we averaged about 150 or 200 that we could hold for the quarterly meetings, but we would have 250 or so for the conferences. But the difference was it was interfaith. We had Buddhists, we had Muslims, we had, of course, Catholic, Christians, Protestants, we had all of that. But the thing is, regardless of how few there are in the other faiths, they still came. Before, they never felt comfortable coming forth. So we went out into their communities, and we went out to everybody's community, brought them back in, and we made sure that the rules were that everyone had to be a respecter of the differences and just embrace the similarities. So we all embraced God in the many names of God, but that was it. You know, we had that commonality. So with that, everybody got along. There was nobody trying to outdo or not feel comfortable or whatever with someone else's faith. So I think that was the biggest challenge, was bringing it together. The other challenge was, where do you meet? We would hold meetings in churches, and our Muslim members wouldn't necessarily come. Or sometimes those members from the Jewish community didn't necessarily come, or they wanted, well, how come you don't come to, you know, the other houses of worship? So how do you get along? We found neutral meeting places. We met at PCA, we met at different community groups that may have had large spaces. We would hold our meetings there so that it would be user-friendly to everyone. I was very, very proud of the fact that we had a huge Muslim women's group that came out, and then they represented their community, and they were called the Jewels of Faith. I was very impressed when we began to have more from the Jewish community that offered input and came out as well. So those were things that we had to do. You have to definitely tie in. And here you may not have those issues, but in Philadelphia, it was almost like everybody was competing or anti anybody else's. We were not user-friendly in the faith community with each other, so we had to break that bond. So that is one thing that I was very proud of. We did become user-friendly on both ends. Most community grassroots organizations were the ones that were most powerful working organizations in the community. And we brought them in and also made sure that they were sharing information and gave them support. We gave them whatever supports they needed if we could, so that they could do their job effectively on a grassroots level. We provided resources for them to help them as well. So those are two things that I think were very important.
Thank you, Sandy. So you may have a follow-up to what was already asked, or something completely different for our panelists. So we want to open this up to the group as a whole. Who'd like to start with the first question of the morning? Yes.
Good morning. My name is Claudia Bowser. I was invited by Sharon to come in. I represent the healthcare field. And looking at the panel, from a nursing home standpoint, I think we cover, I speak to all nursing homes. We cover a grassroots of every issue here for us. I think what's important here is, from an internal part, your patients in the community and residents in the community, they lose faith and hope when they're in the hospitals, when someone is about to expire and pass away, when someone is diagnosed with a brain diagnosis that's terminal. And what's happening is they're leaving the hospitals, coming into your nursing homes with a lack of faith. And what happens is that either they're returning home with no one to provide care for them, or they're now in a crisis situation or mental health that they have to stay in a nursing home. And what's happening is the pharmaceuticals are pushing psychotropic medications. We are one of the facilities that are trying to fight the national benchmark to decrease psychotropic medications and increase holistic. But when the barriers are broken, no matter what faith it is in the hospitals, they come into these nursing homes and they lose hope, from foreclosures to not being able to have anyone to provide care, or grandmothers taking care of all their grandchildren, or their son is strung out on drugs, or someone is basically taking advantage of them. And what's happened is the faith has deteriorated in the nursing homes. And communities aren't coming into the facilities building up their faith or restoring their faith, because they're looking at it from an outlier to where they can come in. These patients cannot return back home without any help. They don't have transportation to get to your parish or your Jewish synagogues. They don't have that. Or if they're diagnosed now with a new mental illness, they don't even know how to transition to even set up a CCT transit services. So what's happening is the bond is broken to where I'm in this hospital figuring out, where are you, God, to help me save my life? And how did I get here at 76 years old, 67, 32? And it's hard, even with the crisis situations. The nursing homes reach out to the crisis situations because they have suicidal increase. The suicidal to ratio has increased so much, as well as the opioids. So what's happening is the faith is broken in the hospitals on an acute level before they go to a subacute level. And there's no internal support coming into these facilities. And what's happening is you're losing that starting on that hospital bed or being told the emergency room, you don't have no health care. You have cancer, you need to go figure it out. You need to go stand in the CAO, county assistant's office, and figure out how you can get medical assistance. And then you walk out and you say, where are you? Where is my faith? I know that you can hear me, but they lose the connection from there. And I represent one facility, but I speak, you have over 2,700 patients in these nursing homes in this whole region. I just represent one company, but I stand on faith knowing that as employees in the nursing homes, you're not even allowed to speak hope into them. That's policy. So it starts in your community. That's it.
Thank you. Yes, appreciate that. Anyone on the panel want to respond or give feedback?
Just share a couple thoughts. Not that it's, there's so many different issues you brought up. But one thing that stuck out to me that you said towards the end there was what you're not allowed to do. And a lot of people in human service organizations talk about things they are not allowed to do. And I think one of the skills we need to continue to develop is an ability to be what we might call bilingual, by which we mean be able to speak both faith speak and human service speak and connect the dots for people. So sometimes when we're training human service organizations, it's helping them to see how do their own embedded values and principles in their regulations, in their organization's philosophy of care, actually give room to collaborating with faith communities rather than work against. So for example, we are told by many of our organizations that we should be, rightly so, culturally competent. But to be culturally competent extends beyond racial and ethnic diversity. It includes diversity of faith. So if we're providing a service and that person says, this is important to me, my spirituality, my faith, my religion is important to me, how can we show that just being good human service professionals means we should be connecting them with a faith community, we should be bringing in faith-based supports, not because we're inherently religious people, but simply because we want to be good professionals. So I think each of us, in whatever system we work in, knowing how to connect those dots for other people in our organizations who've told us you're not allowed to, I've seen become really helpful practice. So I know it doesn't answer that question you brought up, but it's just one path for us each to go down in whatever our system of care is.
I'm going to, from a personal perspective, I'm going to talk about this right now. I had my aunt who had no children, and she was my dad's sister, and I was very close with her. I turned into her primary caretaker as I became an adult. And I saw for the last 6 years of my life her move into a nursing home. And she was somebody who, when I lived with her, she prayed the rosary every single day. Until she couldn't anymore, she would go to church every single Sunday at our local parish. And to see that, and she's also a woman who lived with depression a lot of her life. And so I always say it kind of became my church. I would visit her every single Sunday, and we would spend time together, and that was my church because I would spend it with her. And I did. I even saw her withdraw. There was opportunities at the nursing home for her to go to prayer group or say the rosary, and she wouldn't. And so I think the thing that, because I'm bilingual and I can speak both, is I would encourage if you are in a position that you're not allowed to say things, is how do you advocate and educate family members of ask what you need from their faith communities, ask them to come into the nursing home, ask them to visit with their loved one, to walk in that struggle of, I'm in a hard time in my life, and so it's hard for me to trust in my faith or God because things are hard and I feel isolated. My life is not where it is. I mean, we've seen an increase of suicide in the geriatric population over the past couple years because it becomes very isolating. So I think as a way to be able to do that while staying in your lane so you don't get in trouble in the nursing homes is how do you educate and support family members to ask what they need from their faith communities to show up in those times?
You came with a very interesting point. You brought out the reasons that they're there. You talked about loss of mortgages, loss of, so you got reverse mortgages going on, you got the hunger, you got the healthcare, not knowing things. And that's one of the reasons why we have to make sure that we're not stocking the nursing homes with more people like that. And the only way you can do that is to empower the faith community with the knowledge of the resources so that they can do prevention or intervention before it becomes a crisis, as well as coming forth. And that means using the resources that are available to them that the community didn't know about. So it's all about empowering. And in order to do that, you have to hold meetings like this and gatherings where you share resources and inform them about the things that are available so they can give those resource numbers and connections to the people in the community that come to them for help. If they don't know how or where to go themselves and they don't have the answers, then they can have a person lose even their hope or in their faith because they think, my God has forsaken me because I go to the house of worship and they don't even have the answer. So what do I do? So we make sure that the houses of worship leaders have the answers, at least where to go, so that they can get help. And empowering the leaders of the faith community to be able to know they can make a phone call to any one of these people and say, hey, I'm pastor or reverend, or I'm just a lay leader at such and such a house of worship, and I have a person here, a congregant or a person from our community who needs A, B, C, D. And they know that when they make that one phone call, that one person is going to either give them what they need in terms of resources or connect them to where they need to go and follow up to make sure that it's done. So that's building that relationship. You have to build the relationship. And I think that's very, very important. And also, I think we have to look at our chaplaincy programs. Chaplains also have to be a part of this connection. The seminary schools have to be a part of your resources because they're about to be trained to go out into urban education and urban ministry, but they don't have, some of them don't even have a clue of what it's like to be in an urban environment or how to help them. You have to start preparing them and recognizing that the needs of the people, they're hungry, they're naked, they need clothing, they need food, they need shelter, and these are the issues. They are losing things, they're losing hope, Alzheimer's, dementia, mental health. We have a mental health program that is out there for the faith and grassroots level people to learn about some of the basics on mental health so they'll be even more comfortable making sure they can direct someone from the community to get services, and that includes with recovery or whatever. There are so many resources that are not being fed into the people that really, really need them. So that's empowering both ways. You're empowering the faith community by giving them information and sharing it, and the faith community is empowering the social services to go out and be able to be in an opportunity to actually provide those needs. Thank you.
And I was just really briefly on that going to thank you for your question and share how I think, you mentioned people in crisis heading to the nursing homes, and the work that we're trying to do in our Jewish communities is to raise awareness about disability as it relates to all of us as we age, whether it's mobility, hearing, vision. There will be very few of us, if we have the blessing of living to an old age, who won't be hit by disability in some way. And so we're hopefully, before folks get to that point, We are encouraging people in their synagogues to make calls regularly to the older people who they suddenly might not see showing up. Creating those ride systems. People are not driving at night. They can't get there. Making sure there are committees and people know who to call if they can no longer drive or need transportation to get there. People just checking up in between so that if a crisis or an illness happens and someone does need to go to a nursing home, there will be visitors, there will be someone there, but we're seeing that it really is very, very important in our communities to begin a process of, before the crisis, being aware that our older members need support, and there are more of them as people are living longer, and that we need to change the way we're relating to older people in our communities.
Thank you. Yes, ma'am.
Good morning. My name is Marion Stout. I'm with the Hope and Health Network, and I can honestly talk about reaching out to the faith community. We are a faith-based organization. We do social services, and we also connect people with social services. But one of the most difficult things that we do and we work every day on is connecting with churches, connecting with other faiths, connecting with churches that will even talk to us, so that they know that they can contact us if they have a problem, because churches, as we all know, are the front lines. They're the front lines for all the mental health problems, they're the front lines for all the physical problems that people have problems with in the county. And I can honestly say that we've worked extremely hard to try to reach out to churches, and a lot of times we don't hear from churches. They close, they don't want to hear. They think, first of all, they'll think that we want money from them, and we're not looking for money, we're looking to build a relationship and a connection, because when we help somebody, we build relationships with that individual, and then we try to connect them into the faith community by their neighborhood where they might receive that support. But one of the things that we work hard with to reach out to churches and get them to come out is having seminars. And we've had seminars before. In fact, we've had a seminar with Dave Eckert. I was up at Reverend Buckley's seminar for faith and mental health. We've done seminars on addiction. We've done seminars on trauma. We've done seminars on what to do when poverty comes knocking on your church door. And we've also done seminars on, we're doing a senior seminar in November. Bring seniors out, to bring churches out. And we always constantly have to reach out to the churches. But the churches are not responding the way they need to. And it's like what's happening when a member comes to somebody in their church and they're not connected? What happens when the person goes to, and I think the administrative assistant is the first person, okay, that gets the problem. What's happening if that person doesn't have at least some information or a card or something where they can hand the person the phone number, and that's how people get to me. If somebody hands them the phone number and, hey, give her a call, give Help and Hope and Health a call, because they're going to help you and find the connections. So that's where one of the big challenges is connecting with all the churches in the town, because not of them all are listening.
Panel, any just feedback on ways you've seen they've been able to break down some of those walls to get into some of those places that have, some of the houses of worship that have been more difficult to make connections with?
I mean, I think some of it is just finding, we talk about people of peace, and so who are the people of peace that we can trust and have those conversations with? And I think too, like, I'm really sorry that a lot of churches haven't responded to you, ma'am, and jumped into that conversation. I think it is a problem, and some of it is really because we, like, as a pastor, you're caring for, let's say you're caring for 100 people, and then something comes up in the midst of that, and then I might kind of push them over to, to Dave, and then someone else comes in, and I'm trying to figure out, okay, where does this person go? But it's almost like the more things that pastors can get to like this, they begin to see the bigger picture. And some of it is even just, man, take us out for coffee. Be like, I'd love to grab a cup of coffee with you and just share it with the things that I have. Because honestly, sometimes like seminars are fantastic, but they also feel very unpersonal. And when you sat through a Master's of Divinity education and are working on your doctorate of ministry, you're tired of seminars. And it's great to have a personal interface with someone. And there's something really important about that too, because I'd love to hear the things that you do, but it's also hard because sometimes in places like this, my mind's firing at 1,000 miles. I mean, if you look at my sheet of paper, you're like, a crazy person wrote something here, and I'll try to decipher it later this evening. But I think it's just really important to have those face-to-face connections, because that's too where I can be like, hey, you need to give this lady a call. I think she might be the person to help you there. And so much of it is in that very personal space of when you get to know the person, it's like, yeah, access might not be the right call here. Like, it might be better for me to call Priya Bell, or it might be better for me to call Manna on Main Street, or it might be better for me to do this. But I think it's almost like the more tools that I have, and a lot of those really come from relationship. I would not trust Access Services if it wasn't for Dave treating me to coffee. Like, that really changed our relationship.
Feed pastors.
What's that?
That's the answer. Feed pastors.
Or caffeinate them, yeah. Or a good glass of bourbon. Either way, it's all really good. Yeah, but I think there's something there. I mean, you're right. I think sometimes churches do struggle with feeling like, I think Sandy said this, like, almost like there's this fear of like, well, what do they really want? Or do they want money? Or is this that? I think there is that is present in most pastors' minds.
Just one quick part of that I found helpful is to focus on a person rather than a cause. Because as a pastor, there's so many causes represented in my box every time I go and look at the different papers I've received, and all of them are important. And you're just thinking, what should I focus on? But I think I found that in making relationships with faith communities, when we say, could you meet Bob? Could you talk to Jill? It personalizes it a little bit more. And that's not always possible that those situations will preemptively build those relationships. But I do think the more it's personalized versus cause-driven, the more I've seen responses.
And another thing is, like they said, feed them. Most houses of work, most people lay people like to come and know they're going to have either breakfast, lunch, or something. Feed them, and they will listen to you. But the other part is pastors have a tremendous responsibility over the whole congregation and over the whole community that their congregation serves. However, they can appoint people, they can appoint lay leaders or their associate ministers to come out to your meetings with you, and testimonials. Show them somebody that is from that community that has been helped through some way, shape, or form. Let them do a testimonial that gives proof that yes, this works. But pastors, a lot of times too, no offense, guys, but sometimes the pastors, they go to so many things that get so much stuff, they take it back, they put it on their desk, they're overwhelmed. It doesn't go out to the people that they have working the fields for them and the communities. They just don't have time to share it. Let the ones that are actually the workers come to some of these trainings or meetings and find out, because they're the ones that are going to get excited about using that resource because they're directly connected, because pastors do get overwhelmed.
Yes.
I just wanted to say, as a parish nurse, I think we're an excellent resource for outside agencies to come to the health ministry. Somebody contacts me, I invite them to our next health ministry meeting, and then we can share that with the pastor. So that's kind of how we work.
Okay. I saw another hand. Yes.
I was just going to say, my church is in the heart of Norristown, so there's no money, there's no transportation, I don't have a car, I don't have a cell phone. And when they need help now. So these resources that are not in Norristown, how can I get somebody to connect with somebody in Harleysville or Lansdale? Can you get to Norristown? Can you contact that person right away? When they're calling us, they need help now. And we need to be able to know that if somebody's in trauma,
I can call that agency and they will get in contact with them right now, because a lot of times they don't have time to wait until the next day. My church is not a full-time church with a full-time secretary. Our church phone is my cell phone so that I can answer the phone. So I had somebody call me 2 weeks ago that was in trauma. I had to leave out of my job, go in the parking lot, pray with this woman. But if I need a resource, can I call you right then and there, and can you come to Norristown and help these people? There's so many great agencies and resources, but people need help and they need help now.
Mobile Crisis would love that call.
Yeah.
We would love that call. 24 hours a day, 7 days a week. You get a human.
All right, because that's where the problem is, and people, they need food, they need medication, they need somebody to talk to, and they need it now. So if we can, just my church, if we know that we can call somebody and they'll take care of it then that's what would be a great help.
Yes. Looks like you got one of the answers already right there. Make sure you two get together. Get Mobile Crisis phone number on there. Sandy was going to say something.
Abundance and all these resources, they can come to you. All the resources, all agencies should be able to at least once a month or periodically come, and you have a resource day where they know that the community knows that the people that can help them are going to actually be there, taking information, intaking them right there, giving information to them, and also the phone hotline. If we have a connected interfaith group, then what happens is one person puts that email out, so-and-so needs a ride or needs prayer from such and such, you'd be surprised how they individually respond. It's a connection. It has to be a relationship, and that's where it becomes user-friendly. But yes, resources have to come out into the community. That's exactly what they have to do.
Elizabeth? I have one thing to that. We have a senior center right in Norristown, right on George Street. Please, if you have seniors that need a hot meal, they need companionship. We also have a full-time social worker who's sitting right here that can assist. Send them over to SAC. It's there, every day. Let them come have a hot meal, let them make friends, let them go to activities. And we have a social worker that's going to help them. That's something I don't see a lot in Norristown, which is sending them over to SAC to be there with the other people.
Elizabeth wanted to say something.
Sure, definitely. If the person is in crisis, mobile access is your first call to make. They are definitely the agency that you need to reach out at. If it's for something mental health, suicidality, that kind of thing. But if it's other types of resources too, please reach out. We have advocates in all 4 regions, and the person does not need to go to one of their offices to get help. They're available over the phone, and they will, try to figure out what's going on for that person, what are the resources, and then they can help make those connections for that person.
It's great because you hear people that have needs and those that can help meet the needs right here, which this is what this is all about. But I think I'm getting the sign that I need to wrap things up. So I'm sure there's more questions and more comments, and I'm sure some of that will be dealt with in the breakout sessions as well. But I'll turn it over to you, and thank you panelists for all of your input as well.